Hi, Namaste to all. Welcome to Hum Tum discussion. Before moving on to the next topic, first we will see the classification of neurodevelopmental disorders. First is 6A00 disorders of intellectual development, 6A01 developmental speech and language disorders, 6A02 autism spectrum disorder, 6A03 developmental learning disorder, 6A04 developmental motor coordination disorder, 6A05 attention deficit hyperactivity disorder, and 6A06 stereotype movement disorders. So today our topic of discussion is developmental learning disorder, coded as 6A03 by the ICD-11. So some of the essential features or the required features for the diagnosis of developmental learning disorder involve: first is the presence of significant limitation in learning academic skills that would be expected based on the age, and limitation would be in reading, writing or arithmetic. Next is limitation may be restricted to a single component of skill. For instance, the inability to master basic numeracy or the inability to decode single word accurately and fluently. Or it may affect all reading, writing and arithmetic skills. And limitations are measured using appropriately normed and standardized tests. The limitations are manifested when performance demand related to the learning exceed limited capacities. So the limitations are not attributable to the external factors such as economic disadvantage, environmental disadvantage, or the lack of access to the educational opportunities. The learning difficulties are not better accounted by disorder of intellectual development or by any other condition or a sensory disorder of vision and hearing. The learning difficulties result in significant impairment in the individual academic, occupational or other important area of functioning. So some of the specifier for area of learning impairment we will see. The specifier should be applied to indicate which academic skills are significantly impaired at the time of assessment. The first is 6A03.0 impairment in reading. These are manifested in impairments in reading skill such as word reading, accuracy, reading fluency and reading comprehension. Next is 6A03.1, that is impairment in written expression, and these are manifested in impairment in the writing skill such as spelling accuracy, grammar and punctuation accuracy, or organization and cohesion of ideas in writing. The next specifier is 6A03.2 impairment in mathematics, and these are manifested in impairment in the mathematical skills such as number sense, memorization of number fact, accurate calculation, fluent calculation or accurate mathematic reasoning. Next specifier is 6A03.3, that is other specified impairment of learning that are not adequately characterized by one of the other variable specifier. And last is 6A03.Z, developmental learning disorder unspecified. So some of the additional clinical features required for the diagnosis of this disorder involve: individuals with developmental learning disorder typically show impairment in the various psychological processes that may include phonological processes, that is ability to process and manipulate sounds in language. Next is orthographic processing, that is ability to recognize, process and store written words in memory. Next is memory, that involve working memory, executive functions, for example planning, learning and automatizing symbols, for example visual and alphanumeric symbols. Next is the perceptual motor integration, that means integrating sensory information with motor response, and speed of processing information. So deficits in these psychological processes are presumed to be underlying a child ability to learn academic skills. Next is developmental learning disorder commonly co-occur with the other neurodevelopmental disorder such as attention deficit hyperactivity disorder, developmental motor coordination disorder, developmental language disorder, and autism spectrum disorder. These are persistent difficulties with self-regulatory attention. Premorbid impairments such as language, counting or rhyming, or fine motor control tend to be evident in early childhood prior to the diagnosis of the developmental learning disorders. So, deficits in reading, mathematics, or written expression may negatively affect a child's academic achievement, increase the likelihood of school dropouts, and contribute to unemployment or underemployment in adulthood, particularly if left untreated. And developmental learning disorder is also associated with heightened risk of suicidal ideation or suicidal attempts across lifespan. The prevalence of developmental learning disorder across all area of impairment, that is reading, written expression, and mathematics, is estimated to affect between 5 and 15% of school-age children, and prevalence among adulthood is unknown, but it is estimated approximately around 4%. The prevalence of developmental learning disorder for specific academic areas among school-age children is variable. For instance, for reading it is 5 to 17%, mathematics it is 6 to 7%, and written expression it is about 7 to 15%. And developmental learning disorder is more common among boys. Thank you. If you have any suggestion, please comment below.